Hi everyone, my name is Melanie Grant, and this is C&M Glass. This video is to review for CPT coding on optical and auditory systems, or eyes and ears, for codes in the CPT codebook from 65,091 through 68,899 and 69,000 through 69,979. We're going to touch on a couple of brief key points on eyes and ears for the anatomy, talk a little bit about an operating microscope and when to add that add-on code, and then we'll do some coding examples together. So let's get started. The first thing I want to do is I want to identify that we're looking at the CPT codebook for the 2019 edition from the AMA for the CPT Professional. And we'll be looking at both eyes and ears starting on page 445 of the code book. And then I'm also using for this lecture the Let's Code It 2019 edition from McGraw-Hill. We'll be looking at chapter 25, section 13 and section 15 for our lecture today. So the first thing to look at is the optical and auditory systems. When they talk about this, they're talking about optical eye, auditory ear, or vision and seeing. And we have a couple of really crude diagrams on the board. You have some better ones in the text and coding book that you should definitely refer to before coding in this system. One of the key points in coding with any of your surgical conditions is to identify exactly where it is that your surgery is being done to. In your code book, you have a, similar to this picture here, eye anatomy, where you have the actual eyeball, which includes all of the different layers of the eye, the muscles, and the nerves of the eye. It's important to identify that some of the codes that you'll be looking at are looking at the muscles, the eyelids, as well as the lacrimal ducts, which I've drawn in this picture here as well. So when you're looking at the eyeball, you want to consider it as a whole for this section, unlike some of the other areas where you're going to be in the nervous system or the musculoskeletal system or even the skin. So if we look on page 445 at the table of contents for our CPT coding, we can see that this is going to be categorized by the eye and ocular adnexa, with the headings of eyeball, anterior and posterior segments, ocular adnexa, and conjunctiva. And so that's everything that's included in the eye. When you look further into it, you have various procedures for the eyeball. Under the anterior segment, you include the cornea, anterior chamber, anterior sclera, iris ciliary body, lens, interocular lens, and other procedures. So that's all this area of the eyeball, or the part that you can see. Under posterior, you have the vitreous, the retina and choroid, the posterior sclera, so the back part of the eyeball, and other procedures. When we look at ocular adnexa, we're looking at the extraocular muscles, which should be drawn here. They are not. Those are going to be here and here, exterior muscles. The orbit, so the surrounding of the eye. Eyelids, so you want to keep in mind the skin of the eyelid is considered part of surgeries to the eye, and ocular adnexa, not part of the skin. And then under conjunctiva, it's pretty much everything including the conjunctiva. You have incision, drainage, injection, conjunctivoplasty, other procedures, but you'll also notice the lacrimal system is listed, so any procedures that are done into the lacrimal duct. So just a nice little refresher, you want to look at the eyeball and remember that you have your lacrimal ducts, you have a lacrimal sac, and you have your nasal sinus duct that's connected to the lacrimal of the eye. And so this is just a crude drawing here. You can find some really great ones throughout your book or by looking at any anatomy book for some better visuals with some labels on that to get a better description. So if you also have some really great pictures within the CPT book itself, just kind of looking at this coding chapter, it's a fairly small chapter. There's only one in-section guideline, which is on 448 for keratoplasty, and it gives us guidelines in identifying whether or not we codes that we should be reporting with the keratoplasty, when you're looking at those types of services. Everything else, there's a couple of really great diagrams. You can see some of the muscles on 454 and 455, as well as 456 for things like thrombus surgeries. You can see some of the conditions that may affect to the eyelids. So on 457, where they're going in and they're pulling out ingrown eyelashes, that would fall under this section, not under, say, the skin or integumentary. You do have a little bit of definition under reconstruction. And then you have some of the pictures on page 460 of your code book that show you a much better diagram of the lacrimal ducts and the sac, the various different parts of the lacrimal, I mentioned the ducts, so all of the nasolacrimal section of the eye. And exactly where they go in and how they're doing it. So you want to keep in mind a lot of those are going to be scopic procedures. Things to be aware of when you're coding for procedures in the eye system is pay attention to how they're documenting certain procedures. If they're talking about the approach being endoscopic, if they're talking about using an operating microscope, that's something we'll look at in just a moment. Now you have in your textbook a couple of really great definitions to help you identify different procedures. And keep in mind a lot of these procedures may be done in a medical office or in an eye doctor's office, depending on the type of surgeries. So surgeries for glaucoma, you have vitrectomies, and you want to remember the term for ectomy means to cut. Foreign objects that are in the eyes, so as certain things fly into the eye if it needs to be surgically removed. Dacrocystorhinostomy, let's say that one 5 times fast. That's going to be talking about your nasolacrimal duct, which is identified with abbreviations that are common for NLD. And they're going in and they're going to be looking for some sort of obstruction to take it out or to clear it out. And so they're doing a repair. And then we have some procedures. So not a whole lot in here. It's a fairly small section. Just pay attention. The biggest thing I can say is paying attention to the eyes itself. Now, one that your textbook does not mention is replacement of lenses, which is going to be found commonly done in the medical office, and you can find that on 451 of your coding book. And I'm going to go over there now. You have the difference of incision and removal of a current lens and intraocular lens procedures with cataract extraction. So you want to pay attention to what type of procedure you're doing, if they're incising and removing, or if they're doing something specific to the cataracts. It's important to identify the difference in codes there. So I see a lot of those get denials because they'll be pulled from the wrong ones. Outside of this, it's pretty much straightforward as to where are you at, what are we doing. We have things like incisions, excisions, repairs, and destructions in a lot of these different areas. And so those are some of your key terms. Okay, so let's go ahead and do a scenario together. We're going to be looking at one that you'll see commonly. So we have a U-coded case study here. Ronald Jackson, a 49-year-old male, was working at a metal shop. As he's trimming a steel bar, some metal splinters got in his eye. Fortunately, Dr. Drummond found that the metal pieces presented superficial damage, meaning very minimal or external, and had not embedded themselves in his conjunctiva. Dr. Drummond removed all metal pieces and placed a patch over Ronald's eye. Okay, so we're going to start with what exactly is the surgery that they're doing. He removed the metal pieces, so he's removing, removal. What is he removing? He's not removing the eye, he's removing the metal object. And so this is called a foreign body. Helps if I spell it correctly. EI, one of those weird words like weird where I does not come before E. Okay, and so when we're looking in our alphabetical, we want to be looking for removal of a foreign body from the eye. And we want to keep in mind that the layers of the eye, so the conjunctiva is the outer layer of the eye, and it was superficial, so it did not embed further into it. So I'm going to look in my alphabetical for removal. I'll find that on page 1045, and at the very top of removal, I see that this is removal of foreign body. Hey, that's good. That's exactly what we're looking for. And so foreign body is going to be starting on the semi-top part of the third column. Keep in mind, and you want to pay very close attention when you're going through this, you want to take each step. Removal of foreign body from the eye. Okay, because if you get stuck going to removal of the eye and saying, okay, where was it? Oh, it was in the conjunctiva. You may be telling a completely different story than what the patient had. And likewise, if you're removing something from a body part, not foreign body, but let's say that you came in on the next page and didn't pay attention to the term foreign body, you could end up getting the wrong code because of that. So when you're in here, pay attention to your categories that you're looking at and what your headings and subheading is. So I have removal of foreign body, and I'm going to go down here and I'm going to find either the eye, the conjunctiva. I see conjunctival embedded. 65210 is not going to be my code because they mentioned it was not embedded in the conjunctiva. So I'm going to keep going. Okay, and pretty much they didn't say where in the eye, just that it was on the external part, or just that it was in the eye. So I want to keep in mind the external part of the eye is going to be the outer part of the conjunctiva if it's not embedded. So I have here eye, anterior chamber, corneal eyelid, external eye, and posterior segment. So the only thing I can really say that this is the external eye, which is going to give me a code range from 65205 through 65222. And I'm going to write that down so I can reference all the codes. Now, if there was additional ones that would apply, I would write those down as well. But I don't feel from looking at this that any of those others would apply. So I'm going to go directly now to my eye section. And find code 65205. Now, when I go through this, I like to look at the table of contents as well and make sure that that's correct for where I would be coding from. And so the 652 is going to be found as part of the eyeball itself under 65091 through 65290. And I would ask myself, is that correct to the anatomy? And it is. And so in the table of contents, I can see that starts on 447. And so for the header of eyeball, I have removal of eye, secondary implants, removal of foreign body, and 65205 through 65222 all fall under removal of foreign body. There is a little bit of in-section guidelines here. It's not so much as in-section notes, it's just giving me additional areas to consider. So if I was removing implanted material, diagnostic x-ray for the foreign body, echography for the foreign body, if it was in the orbit, if it was in the body of the eyelid or embedded, and if it was in the lacrimal system, I would have different codes. And so it's just giving me a little bit of guidelines, not so much in-section guidelines as it is just a reference. None of those apply, so I'm going to look at my code options here. And I can see that code 65205 is a standalone code, removal of foreign body, external eye, conjunctival, superficial. That sounds exactly like my description of what I need, so I'm pretty sure 65205 is my code. But I always read up and down, and I see there's a few indented codes. So for removal of body of the external eye, I have conjunctival embedded, corneal without slit lamp, and corneal with slit lamp. And because none of those are indicated in my note, if it's not documented, it didn't happen. So I'm going to go with the original one I saw, 65205. And that's going to be my code. Pretty simple, pretty straightforward. The biggest thing in the system, again, is identifying your anatomy and making sure you're in the correct area. The eye system goes throughout, including, remembering that it includes the eyelid, includes the lacrimal ducts and the orbit. That's going to be some of your biggest areas, as well as the ocular muscles. All right. Moving on and looking at our other chapter we're talking about, or the other part of this chapter, which is the auditory system, you'll find immediately after the eyes on page 463. And you'll notice that the auditory system, including operating microscope, is from 463 through 468. So there's about 5 pages here. My coding chapter starts for code 69,000 through 69,979 on page 463. And it lists the headings for external, middle, and inner ear, and then temporal bone, middle fascia approach, and operating microscope. It's fairly simple, fairly small. There are no in-section guidelines for the auditory system. And so you'll notice that each of these also has pretty much a straightforward incision, excision, removal, repair, and other for your subheadings. So the types of procedures you're going to see in the auditory system are pretty straightforward. We're cutting out, we're cutting into, we're removing, we're repairing, and of course that foreign body is also something we may look at. In our reading, we also talk about pretty much the same thing, and we have some definitions of what's included in the outer, middle, and inner ear. So this is one of the things that's really important is your anatomy. You also have this on page 463 of your textbook, although it doesn't identify the different sets of the ear. So it might be beneficial to you to mark it in your code book if it's something that you like to do. So on your external part of the ear, some things to pay attention to. It includes your auricle or the pinna, also known as the earlobe, your external ear canal, and the outer part or external part of the tympanic membrane, also known as the eardrum. On the middle ear, you include your auditory bones, which includes your malleus, incus, and staples, and I've drawn a little crude drawing of those here. And then you also have the oval windows and the eustachian tube here. And you'll notice I kind of drew a very not to scale person, where you can see that the eustachian tubes drain into the nasal cavity and through the nasal cavity into the oropharynx. This is really important to identify because there's going to be a lot of procedures with patients who have conditions with the eustachian tubes, especially young children getting constant ear infections. Those would be middle ear infections when it's indicated, and when they're replacing the eustachian tube, they're going to find that in the middle. In your inner ear, you include your cochlea and your circular canals, and you'll also see that other things that come into here. You have your vestibule and auricle nerve, auditory nerves, which come in here, but are not included in your, not necessarily included here. So you want to pay attention to your inner ear. Let me double check that. As I'm saying it, I'm thinking, wait a second, there was something I had wrong. Okay, yeah. So those do not include procedures to the nerves. So if they're doing something to the nervous system here, that would be coded in your neurological conditions. So just verifying that, because when you talk about diagnoses, we do include those. When we talk about procedures, we do not. Okay, so if you're taking this as a dual class where you're learning both CPT and ICD-10-CM, that's something of noteworthy. Okay, so pretty much the types of procedures you see on the ear are pretty straightforward, as I mentioned. One of your more common ones is a tympanostomy. which is where they're going in for middle ear infection, also known as otitis media. And there's fluid building up, and again, that's where I was talking about the middle ear infection having fluid directly into the ear. And this you can see here, code 69433 versus 36, including or requiring insertion of a ventilating tube, local or typical anesthesia versus general, versus just a ventilating tube removal. So they have a couple of different things there. It's not a whole lot, but they did give us an example that we can look at. Most of the time what you see with external ears, what you will see common, and one of the things I can point out is under 464 in the external ear, one of the most common procedures that a provider may do is removal of earwax and foreign body. And it's important on these to pay attention to how these are documented. If you're doing, for example, removal of a foreign body from an external auditory canal, you would code 69200, and you'll notice that this is only for one ear, not bilateral. If you were doing removal of impacted earwax, there needs to be documentation that the earwax is impacted, meaning that there's pressure in there, and it's using irrigation or lavage. And so they have to document how they did it, and that's unilateral. So if they did it out of both ears, you would bill that bilaterally. Now it does indicate here some of the documentation on that. And then there's a difference here, and the reason I wanted to point this out is there's a difference between impacted cerumen requiring instrumentation. So if they have a little tool that they're going in and they're scooping out the earwax, that's 69210. So you have a little bit of differences. Pay attention to some of those in-section notes that are in parentheses. Those aren't guidelines, but they're meant to give you guidance. Okay, those are the most common that I see in the medical office, aside from the eustachian tubes, because there really just isn't a whole lot of procedures that are done to the ear. Most of the infections and diseases, you may have some exploratory, but most of the time patients are able to get conditions resolved. So under our case study, we're going to look at one here where they don't have a resolution because we have a patient who is deaf and getting an implant. So another case where it's not necessarily an infection. All right, so we have Anna Mendoza, a 33-year-old female who is deaf since she was 11. She's admitted today with Dr. Eberhardt to put a cochlear implant in her left ear, and is expected that Anna will gain back much of her hearing. Well, first of all, that's not a procedure note. That's telling us what they're planning to do, but we're going to code it as if it was. So we will read through that and say, what is it that they're doing? It's a cochlear implant. And so our action word, or the thing that we're doing today, is we're implanting or inserting. So we always want to think of it like an implant is an insertion of a device. Okay, so these are some keywords that they aren't saying. Is that an implant is an insertion of a device, and the type of a device is a cochlear. Oh, and go back to the orange here. Okay, and so this is going to help her with her hearing. So it's a device to go and replace that little snail-looking cochlea. And which ear is it? It is in her left ear. Okay. So I'm going to go to my alphabetical, and I'm going to look for insertion, because I'm going to remember that an implant is also known as an insertion, although I may find it under implantation. So I can look under both. I tend to try to think of all the terms I might find it under. So oftentimes what I do is I think of the synonyms, and I start alphabetically first, implant or insertion. And I actually have implant in here, so I'm going to look at implant, which starts on bottom of page 973 and continues on. Implantation, and it breaks down various different areas of the body. I do have cochlear device. And this one's actually a very direct term. So even though I'm thinking insertion in my head, I found it under implant. And so it's good to have those, but it's also good to look at all of the options. And so it only gives me one code here. It seems pretty straightforward. Implantation, cochlear device, 69930. So that does seem accurate. I'm going to go now to my ears and look at my ear section. Those 5 pages, I know it's a very long section here. So big that it's hard to go to it. 463, I'm going to notice that 69930 falls under the heading for inner ear. And I'm going to ask myself, is the cochlea part of the inner ear? It is. And that starts on page 467. Under the inner ear, 69930 falls under introduction. So another term, introduction, to introduce, to implant, to insert. Yes, that would be correct. And it has cochlear device implantation with or without mastoidectomy. So that's correct. There is no additional information I would need. They do have a really great diagram that gives me a visual of what they're doing. And so if I was reading through the op note and I came in here and I wanted to understand a little bit more about what's included in that procedure, I could look through here and I can see that it includes an internal coil attached to the temporal bone and the ground wire attached to the internal coil connected to the temporalis muscle. And so I can kind of see how they're going to take that guide wire in, they're going to talk about that in documentation, and then they're going to make a little pocket to hold that device on the external part of the ear, most likely. And I see that it doesn't have any details for different types, so whatever type of cochlear device they have would fall under this code. So this is my code 69930 for an implantation of a cochlear device. Well, that's it for today. As you're going through your coding, oh, we have one more thing, which is our operating microscope. I'm kidding, we're almost done. So one of the things when you're looking at eyes and ears is a lot of your procedures are going to be to very, very small areas. And because of that, the provider may document the use of a microscopic or microsurgical microscope, an operating microscope. When this is documented, this is found under the auditory section. Why it's there, because it actually can apply to other areas. I can't tell you, just that that's where it's found. Code 69990. And this has some in-section guidelines on it. So it's on coding, on your coding chapter, page 468 for your CPT book. Operating microscope, surgical microscope employed when surgical services are performed using techniques of a microsurgery. So you're going to pay attention for keywords on certain types of surgeries for code 69990. It would be reported without modifier 51, meaning that it is an add-on code, and because it's an add-on code, it is modifier 51 exempt, and it also does not need a modifier 59. It's added in addition to the primary procedure performed, meaning that you're always going to have the primary procedure first, and then this as a secondary. There is a long list of codes here that we do not report an operating microscope because the procedures themselves include this or would be unlikely to use this. And so you want to pay attention to this when you're adding on. If the provider has documented the terms operating microscope, pay attention to the original procedure and see if it falls under the do not use list. In my case, for my cochlear implant, let's say that they mentioned an operating microscope. I would come and I would look up 69930 first, like we did, and then I would come here on 468 and say, is 69930 part of this list? And it actually is not. So if they used an operating microscope for our procedure, then we would list our codes 69930 and 69990. Because it's an add-on code. Let me add one more 9 to that. Pay attention to your typos because they do matter. And make sure your zeros and O's because those matter as well. In this case, we did not have the 69990. It's just used to talk about it as an example. That's how we would add it. It's pretty basic, straightforward documentation, but it's something to be aware of because it's an additional payment. Now, I promise you, that's all for today. Until next time, have a great day.